Welcome to the Ramona Unified School District's mandated COVID-19 training. This training will cover the following topics: facts on COVID-19, what to do to prevent the spread of the virus, how to properly wash your hands, symptoms of COVID-19, and additional resources for employees. Here are some facts on COVID-19. COVID-19 is a disease caused by a virus called SARS-CoV-2. Most people with COVID-19 have mild symptoms, but some people can become severely ill. Although most people with COVID-19 get better within weeks of illness, some people experience post-COVID conditions. Post-COVID conditions are a wide range of new, returning, or ongoing health problems people can experience more than 4 weeks after first being infected with the virus that causes COVID-19. Older people and those who have certain underlying medical conditions are more likely to get severely ill from COVID-19. Vaccines against COVID-19 are safe and effective. COVID-19 spreads when an infected person breathes out droplets and very small particles that contain the virus. These droplets and particles can be breathed in by other people or land on their eyes, nose, or mouth. In some circumstances, they may contaminate the surfaces that they touch. People who are closer than 6 feet from the infected person are most likely to get infected. A person can contract COVID-19 if they come in contact with another person infected with the virus, someone infected coughs or sneezes directly on them, they touch any surface with little droplets from infected people's cough or sneezes and then touch their eyes, nose, or mouth. Informing the population about the health risks posed by the coronavirus disease, as well as what they can do to protect themselves, is the best way to mitigate the spread and reduce the amount of further contagion cases. Next, we will go through helpful advice on how to prevent the spread of the virus. Here are ways for you to protect yourself. 1. Get vaccinated. 2. If you are not fully vaccinated and age 2 or older, you should wear a mask in indoor areas. 3. Consider wearing a mask in crowded outdoor settings and during activities with close contact with others. 4. Clean and disinfect frequently touched surfaces. 5. Wash your hands often with soap and water for at least 20 seconds. If soap is not available, use hand sanitizer. 6. Avoid touching your eyes, nose, and mouth with unwashed hands. If someone in your home is sick, continue to practice everyday preventive actions as usual. Keep the ill person in a separate room from others in the household. If caring for a sick household member, monitor your own health too. Keep surfaces disinfected and also avoid sharing personal items. If you become sick, stay home and away from others. Take care of the emotional health of your household members, including yourself. Social distancing is another way to prevent the spread of the virus. Safely distance yourself from others by keeping at least 6 feet of distance between yourself and other people. Try to avoid large groups and crowded places. Keep distance from others, especially if you are at high risk. Covering coughs and sneezes. Always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Make sure to throw used tissue in the trash. Immediately wash your hands with soap and water for at least 20 seconds or use hand sanitizer. Next, we will go over cleaning frequently touched surfaces and objects. Below are the Center for Disease Control and Prevention and the Environmental Protection Agency's cleaning and disinfecting guidelines. Clean and disinfect frequently touched surfaces daily. This includes doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, make sure to clean them. Use detergent or soap and water prior to disinfection. Use only EPA-approved solutions to clean and disinfect. The Healthy Schools Act requires additional training for all school employees using disinfectants. We must each do our part to help prevent the spread of COVID-19. Another way to do this is by properly washing your hands. When washing your hands, make sure to use a soap with at least 60% alcohol. Start by washing your fingers, then wash palm to palm. Wash your fingernails, your wrists, and thumbs. Finish by drying your hands with a clean towel, and your hands will be disinfected. Here are symptoms of COVID-19 to watch out for: fever, cough, headache, shortness of breath, chills, loss of taste or smell, sore throat, muscle pain, and diarrhea. Symptoms may appear 2 to 14 days after exposure. People with COVID-19 have reported a wide range of symptoms ranging from mild to severe. Remember that this list is not a full list of possible symptoms. The CDC will continue to update symptoms. There are also emergency warning signs to keep an eye out for: lips or face suddenly turning bluish, persistent pressure in the chest, confusion or inability to wake up, and difficulty or trouble when breathing. If you or someone you know is experiencing any of these symptoms, call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. Employees have rights when it comes to COVID-19. Employees have the right to request a respirator for voluntary use without the fear of retaliation. Employees voluntarily using respirators will be trained according to Section 5144C2 requirements. Employees are afforded all eligible leave. Unvaccinated employees will be tested weekly at no cost and will be afforded time to test if necessary. Employees can request face coverings and can wear them at work regardless of vaccination status and without fear of retaliation. Alternative resources can be accessed by visiting the district's website. There you will find the RUSD Safe School Opening Plan for 2021-2022, training videos from the National Association of School Nurses on washing your hands and wearing face coverings, the COVID-19 decision tree, and the CDC's guidance for COVID-19 prevention in K-12 schools. If you have any questions or would like further information, please contact your supervisor and they will be happy to assist you.